Hello there everyone, this is 5 Minutes Medicine and today we are going to discuss jaundice, or the condition in which we see yellow discoloration of skin, sclera and mucous membranes, and which is caused by increased level of bilirubin in blood. Since we said jaundice is caused by increased bilirubin, we should understand the bilirubin mechanism first. So when the RBCs are destroyed after the normal cycle, the hemoglobin is broken down into heme and globin, where globin being the protein so is reabsorbed quickly, whereas heme is broken down into bilirubin in blood vessels and spleen, and is then sent to liver, where it gets conjugated and is made water soluble, and is then excreted via the routes of urine and stool. Time for pictorially understanding the bilirubin mechanism. So when the RBCs and hemoglobin is destroyed, after completing their life cycles in blood vessels and spleen, the yellowish pigment called the bilirubin is formed, which is then sent to liver for conjugation, storage, and is made water soluble for later, as it has to be sent to kidneys and intestine for excretion. So based on the sites of events, the process is divided into three major types, namely the pre-hepatic phase, the hepatic phase, and the post-hepatic phase. So we have learned that the bilirubin mechanism is divided into three main steps. So if there is any increase in bilirubin levels, it's mainly caused by alteration of these steps, which can be elaborated as by excessive destruction of RBCs, by an underlying disease or a condition related to our liver, or due to obstruction of the route of excretion of bile, causing leakage to nearby tissues, making the tissue and the membranes yellow. Jaundice is classified into three main types, which are important for deciding the course of treatment, and which are prehepatic jaundice or hemolytic jaundice, hepatic jaundice caused by diseases like cirrhosis, etc., and post-hepatic or obstructive jaundice. The classical signs and symptoms of jaundice includes yellow discoloration of skin, sclera, and mucous membranes, dark-colored urination, light-colored and fatty stools, severe body itching, generalized weakness, and abdominal pain. Diagnosis of jaundice depends on physical analysis and the presentable symptoms like yellow skin and iris, upset stomach, etc. Adding on that, urine analysis, serum bilirubin levels, complete blood count, ultrasound, and CT scans are done for diagnosing the type and severity of the condition. Liver biopsy can be used for diagnosing the underlying cause and for differentiating it from other plausible causes. The treatment of jaundice is mainly based on treating the underlying cause and relieving the annoying symptoms. For the cases of hemolytic or anemic jaundice, supplemental iron and food rich in iron is prescribed. For the jaundice which is caused by liver infection, drugs like antivirals are used. For obstructive jaundice, removal of obstruction through surgical or medical intervention is required, and if it is a drug-induced condition, immediate cessation of that medication is prescribed. So that's it for today's video, which was a quick recap on jaundice. If you liked the video and found it informative, please help the channel to grow by liking, sharing, and subscribing. Thank you and see you until next time.